Hello, my name is Dr. Dewan S. Raja. Today I will solve a few multiple choice questions, and the answer key and the reference book list I will put in the description bar of my video. If you have any chance, please look at the answer key and the reference book, or you may collect the reference book, including one of my book that is a multiple choice question book. So let's start the multiple choice question. Number 66. What structure passes through the foramen indicated by the blue arrow? We have two foramen here, so it is foramina, and the structure goes through each foramen is the vertebral artery. Answer is B. So this is the answer. B is the answer. Then a vertebra with neither a body nor a spinous process is what? Axis, sacrum, coccyx, atlas, vertebral prominence. Answer should be D, atlas. Okay. Then superior attachment of the nuchal ligament, we also call it ligamentum nuchae, is on the, what is the attachment? Masted process, external occipital protuberance, transverse process the atlas, transverse process of the axis, spinous process of the seventh cervical vertebra. Answer should be external occipital protuberance. B is the answer. B for boy. During a road traffic accident, a 45-year-old man had severe hyperextension of the neck. Which of the following ligament is most likely to be damaged in this scenario? Ligamentum flava, anterior longitudinal ligament, posterior longitudinal ligament, supraspinous ligament. Answer should be anterior longitudinal ligament. Question number 17. The anterior tubercle of the transverse process of which of the following vertebrae is called carotid tubercle? That is C6. Okay. The transverse foramina of which of the following vertebra do not transmit vertebral artery? That is vertebra C7. It carries one accessory vessel, not the main vertebral artery. Not the vertebral artery, but it may contain some emissary veins. Okay. So the membrana tectoria is a continuation of which of the following ligament? Anterior longitudinal ligament, posterior longitudinal ligament, ligamentum flava, ligamentum nuchae. Answer should be anterior longitudinal. No, answer is the posterior longitudinal ligament. That will be the membrana tectoria. This is the answer. Posterior longitudinal ligament. Which of the following ligament is located inside the vertebral canal? Answer should be posterior longitudinal ligament. Okay, which of the following ligament is attached to the medial tubercle of the lateral masses of the atlas? Answer should be what? Apical ligament, alar ligament, transverse tubercle, and the interspinous ligament. Okay, so we have the attachment of the transverse ligament to the medial tubercle of the lateral mass of the atlas. Okay, which of the following bones is the superior longitudinal ligament of cruciate ligament attached? Basilar part of the occipital bone, anterior arch of the atlas, posterior surface of the axis, transverse process of the atlas. Answer should be A, basilar part of the occipital bone. Which of the following cervical vertebra has a bifid spinous process? Okay, has a non-bifid spinous process. Answer should be C7, non-bifid spinous process. Which of the following structure passes through the indicated foramen? Indicated, that means that here the small one, not this, not that. This is the foramen. We also attempt here, this is another foramen. The foramen spinosum that carries what? Mandibular nerve, maxillary nerve, middle meningeal artery, hypoglossal nerve, optic nerve. Answer should be from the middle meningeal artery that passes through the foramen spinosum. It comes out, it enters the cranial cavity through this foramen. So our answer should be middle meningeal artery. Okay. Here, MCQ in head and neck anatomy. Identify X indicated area, this area. Basilar part of the occipital bone. Yes, we got it. Basilar part of the occipital bone. Okay, this is the basilar part. Then body of the sphenoid bone. It also come here. Then vomer, medial pterygoid plate, lateral pterygoid plate. So our answer should be this. Body of the sphenoid bone. All of the following structure passes through the foramen, yellow, this is the foramen, except one, the exception is what? Okay, end of middle oblongata, beginning of spinal cord, internal jugular vein, vertebral artery, spinal root of the accessory nerve. Answer should be what? Internal jugular vein. Okay. Which of the following muscle is involved in congenital torticollis? Like scalene anterior, scalene medius, scalene posterior, sternocleidomastoid, and liberator scapulae. Our answer should be scalene anterior. Okay. This is the choice. Okay, it's the time to wrap up. Okay, here we have to know the major openings. Okay, we have to know which of the following muscle is involved in congenital torticollis. Then it should be sternocleidomastoid muscle, not liberator scapulae, nor scalene anterior medius posterior muscle. Answer should be the sternocleidomastoid muscle. Okay.